See an NCLEX RN video based on care for patients with peripheral nervous system disorders. The peripheral nervous system disorders include myasthenia gravis, Guillain-Barré syndrome, and trigeminal neuralgia. In evaluating a respiratory status in the patient with myasthenia gravis, the nurse correlates vital capacity measurement to which parameter? Amount of gas that the lungs can hold, amount of oxygen contained in the lungs, amount of air that can be forcibly exhaled after maximal inhalation, amount of oxygen that can be exhaled at a slow rate. You know that the patient with myasthenia gravis experience clinical manifestations including respiratory deterioration and muscular weakness. Because of the potential for respiratory weakness, a bedside test known as the vital capacity is performed. Vital capacity is defined as the maximum amount of air exhaled following maximal inhalation. A patient has normal respiratory function with a value of 65 ml per kg. When a patient's value falls below 15 ml per kg or generally 1 liter, respiratory deterioration may progress rapidly and mechanical ventilation may be required. When providing patient teaching about plasmapheresis to a patient with myasthenia gravis, the nurse explains that the purpose of the procedure is which result: reduce the levels of calcium and magnesium in the blood, remove excess acetylcholinesterase from the plasma, deliver deficient proteins directly into the blood, remove acetylcholine receptor antibodies from the blood. Plasmapheresis is a treatment of choice which is done as myasthenia gravis. During plasmapheresis, the patient's blood is removed through the arterial lumen and circulated through the plasmapheresis machine, which removes the antibodies that block the acetylcholine receptor function. The goal of the treatment, that is plasmapheresis, is to improve the muscle strength, and anticoagulants are required during this procedure, and mainly citrate is the anticoagulant of choice during a plasmapheresis procedure. So here it is to remove the acetylcholine receptor antibodies from the blood. Which statement by the patient with myasthenia gravis indicates the need for further teaching? My weakness will get worse when I exercise too much. It is important that I take my medications 30 minutes before or after eating. My eyes will get tired if I read too much. I need to wait for 30 minutes after taking medication to eat or drink. So in myasthenia gravis, the accepted initial treatment of choice is pyridostigmine. It is a medication that is a reversible inhibitor of acetylcholinesterase. So one of the main things you need to consider when taking this pyridostigmine is the patient should take this medication exactly at the prescribed hour, and this medicine should be administered 30 to 60 minutes before eating, not after eating, before eating, because it optimizes chewing and swallowing. A patient with Guillain-Barré syndrome was admitted to the nursing unit with ascending motor paralysis. He has been a patient on your unit for 2 weeks. As the nurse provides teaching to the patient, how does the nurse describe the resolution of his paralysis? In the reverse order of the onset of symptoms, in the lower extremities first, followed by the breathing muscles, as evidenced by bladder and bowel control in one limb at a time. So the recovery phase of the Guillain-Barré syndrome disorder begins when the patient starts to improve and function returns in the reverse order of the onset of the symptoms. That is in the descending order we can see the improvement. What patient education is most important for the patient with trigeminal neuralgia prior to eating a meal? Avoid using a straw in beverages. Avoid brushing your teeth for 2 hours after a meal. Avoid iced beverages and ensure that food is soft and easy to chew. Close the door to provide privacy for meals. You know that the fifth cranial nerve is called the trigeminal nerve. The stimulation of cranial nerve 5 can trigger pain. The patient needs to avoid beverages and food that are of extreme temperature, and the diet should consist of soft food. The nurse recognizes which explanation as the pathophysiological basis of myasthenia gravis. There are an inadequate number of muscarinic receptors. Antibodies to acetylcholinesterase receptors block neuromuscular junction transmission. Thymomas are present in 80% of patients with myasthenia gravis. There is an abundance of acetylcholine which binds to viable receptors. In myasthenia gravis, circulating anti-acetylcholine receptors antibodies bind with the acetylcholine receptors, resulting in complement-mediated destruction of the receptor sites. The postsynaptic membranes lose their force and acetylcholine binding is blocked. So here, antibodies to acetylcholine receptors block the neuromuscular junction transmission in myasthenia gravis. During the endrophonium or tensilon test, a short-acting acetylcholinesterase inhibitor is administered intravenously and the provider observes the patient for improvement in which function? Level of consciousness, muscle strength, muscle tone, hearing. Endrophonium is a short-acting anticholinesterase medication that is administered via IV push. Endrophonium temporarily improves the neuromuscular transmission by inhibiting the acetylcholinesterase, which is the enzyme that degrades the acetylcholine after binding to the acetylcholinesterase receptor site. Before the medication is administered, the provider focuses on a weak group of muscle and assesses for the improvement of the muscle strength. It does not directly impact the level of consciousness or hearing or muscle tone. And the provider will be observing whether the muscle strength is regained or not after few minutes, which indicates a positive sign. The nurse assesses for which clinical manifestation in a patient admitted with myasthenia gravis. Select all that apply. Ptosis, diplopia, hyperventilation, dysphagia, bitemporal headaches. Myasthenia gravis is a motor disorder characterized by fluctuating localized skeletal muscle weakness and fatigue. Ocular symptoms include ptosis and diplopia. Cranial involvement may also cause difficulty swallowing, which is dysphagia. Generalized muscle weakness may also lead to decreased respiratory effort, not hyperventilation. Which action is critical when administering a pyridostigmine 60 mg tablet to a patient with myasthenia gravis? Administer with milk and crackers to minimize gastrointestinal distress. Administer 2 hours after meals because food slows gastric absorption. Administer 30 to 60 minutes before meals to optimize strength of chewing and swallowing muscles. Administer with orange juice because vitamin C facilitates gastric emptying. Also, we have seen when the patient is taking pyridostigmine, it must be administered exactly at the prescribed hour to maintain the optimal muscle strength, and patient who is taking this pyridostigmine 1 hour before the meal they have to take to minimize difficulty with chewing and swallowing before the meal. That is important. The patient with myasthenia gravis need to be educated about medications that should be avoided because they can increase the weakness. Which medication should the patient avoid? Acetaminophen, prednisone, azathioprine, maloprine. Certain medications are contraindicated in myasthenia gravis, which include some antibiotics, calcium channel blockers, D-penicillamine and magnesium. So here if you are seeing this Malox which contains magnesium, so that should be contraindicated. That is contraindicated in myasthenia gravis because it causes muscular weakness. Magnesium is an antagonist of calcium, which is important for muscle contraction. So here Malox should be questioned or avoided. What pathophysiologic processes occur in the first stage or the acute phase of Guillain-Barré syndrome? Peripheral nerve demyelination, edema and inflammation, depolarization of the spinal nerves, destruction of the myelin-producing oligodendrocytes, regeneration of the myelin sheath. There are three stages of Guillain-Barré syndrome. The first stage is known as the acute stage, and it starts with the onset of clinical manifestations of peripheral nerve demyelination or destruction of the myelin sheath. Then there will be edema and inflammation, and this phase lasts approximately for 4 weeks. The nurse correlates respiratory compromise in Guillain-Barré syndrome to which pathophysiologic process? Decreased protein in the CSF, progressive limb weakness, diaphragmatic weakness, decreased acetylcholine at the neuromuscular junction. Due to demyelination of the peripheral nerves, up to 40% of patients with Guillain-Barré syndrome develop respiratory impairment. Respiratory failure is caused by weakness of the diaphragm and intercostal muscles, and the patient may require intubation and mechanical ventilation to provide respiratory support. It's because of the diaphragmatic and intercostal muscle weakness. Which nursing intervention is a priority for patients with cranial nerve impairment from Guillain-Barré syndrome? Perform sensory checks with neurological examination below the level of the cervical spine. Consult with the provider for initiation of continuous positive airway pressure for breathing. Create a turning schedule with limited time in side-lying position. Establish effective communication using eye blinks or a communication board. The nurse recognizes which class of medications is most effective in the management of trigeminal neuralgia. Anticholinergics, antihistamines, antibiotics, anti-epileptics. Medications used in the treatment of trigeminal neuralgia include the use of anti-epileptic drugs such as carbamazepine, oxcarbamazepine, or gabapentin. Carbamazepine is the first line of medication therapy used in the treatment of trigeminal neuralgia, and it works by reducing the excitability of neurons by inhibiting the neuronal sodium channels. Which surgical approach is most effective for the patient with trigeminal neuralgia? Stereotactic radiosurgery, cervical decompression, microvascular decompression, percutaneous ablation. The most effective surgery is the microvascular decompression. Here, the facial pain is usually relieved within 24 to 48 hours, and the patient does not have any residual facial numbness also. A 45-year-old married female with a 15-year history of myasthenia gravis. Last week she developed an upper respiratory infection with a fever of 101.1 degree Fahrenheit. During this time she also developed increasing muscular weakness of her legs. During dinner she experienced marked difficulty with chewing and swallowing. Her medications include predostigmine 60 mg every 4 hours while awake, predostigmine time release 180 mg at bedtime, and prednisone 20 mg daily. Following an evaluation in the emergency department, Ms. Jordan is admitted to a neuroscience inpatient unit where begins a course of antibiotics for her upper respiratory infection. Her pyridostigmine dose is increased to 90 mg every 4 hours round the clock and the prednisone is increased to 40 mg daily. On Ms. Jordan's admission, her examination reveals bilateral ptosis, dysarthria, that is difficulty speaking, and dysphagia, difficulty swallowing. Speech is slurred and she has difficulty with swallowing secretions. Her vital capacity is 1.3 liter. She has diminished strength in all 4 extremities and requires the assistance of 1 nurse for ambulation. Her vital signs are BP 110/70 mmHg, heart rate 114 beats per minute, respiratory rate 28 and temperature 100.3 degree Fahrenheit. Mrs. Jordan requires insertion of a nasogastric tube for medication and an infusion of normal saline is initiated for dehydration. Ms. Jordan demonstrates increasing weakness and requires 2 nurses to assist her to the bathroom. Her speech remains slurred and is now incomprehensible. The nurse performs a neurological assessment and obtains a forced vital capacity. The vital capacity measurement is 0.8 liter. Oxygen saturation is 95% on room air. The provider is notified of the vital capacity and an arterial blood gas is drawn. The results are pH 7.28, PaCO2 70 mmHg, PaO2 85 mmHg, HCO3 25 milliequivalents per liter. The patient is moved to an intensive care setting where she is intubated and placed on a mechanical ventilator. A neostigmine infusion is initiated in order to determine her anticholinesterase requirements during this acute phase of illness. The healthcare provider decides that Ms. Jordan will have 5 plasmapheresis treatments and a dual lumen plasmapheresis catheter is placed. After 3 additional plasmapheresis treatments, Ms. Jordan is able to be extubated and returns to the inpatient unit. Her vital capacity at this time is 1.5 liter. She completes her final plasmapheresis treatment and is discharged home. The nurse ensures that Ms. Jordan is knowledgeable of her medications and the importance of taking her medication at the exact time prescribed. Discharge teaching also focuses on clinical manifestations of myasthenic and cholinergic crisis. So this is the case of a patient with myasthenia gravis. Ms. Jordan has been taking prednisone 20 mg daily for management of her myasthenia gravis. What side effects should she be monitored for during her hospitalization? Hyperglycemia, weight gain, cardiomegaly, heart failure, insomnia. Side effects of prednisone is steroid include immunosuppression, then hyperglycemia, weight gain and sleep disturbance. So here hyperglycemia is a major problem. Patient's blood glucose need to be monitored closely. The autoimmune dysfunction in myasthenia gravis results from which process? An overabundance of acetylcholine, an inadequate amount of acetylcholine, an inadequate amount of serotonin, destruction of the postsynaptic membrane. Myasthenia gravis is an autoimmune disorder that is a T-cell dependent antibody mediated destruction or the deterioration of the neuromuscular junction. Acetylcholine is released but the postsynaptic membrane is less sensitive. So here the destruction of the postsynaptic membrane is there in myasthenia gravis. While caring for Ms. Jordan, the nurse monitors for which manifestation of a cholinergic crisis? Bradycardia, angioedema, diarrhea, increased heart rate, decreased cell. Cholinergic crisis is due to excess intake of anticholinesterase medication and is potentially secondary to a patient taking too much of the prescribed myasthenia gravis medications. And this clinical manifestations or features of cholinergic crisis include muscle bradycardia, then fasciculations, that is muscle twitching, sweating, pallor, excessive secretions and small pupil. Bradycardia you can see, Warm skin, it is not there. Abdominal cramps, diarrhea you can see, and increase in secretions, not decrease in secretions. During her hospitalization, Ms. Jordan received plasmapheresis treatment. Following the plasmapheresis treatment, the nurse monitors Ms. Jordan for which complications? Hypotension, Stevens-Johnson syndrome, hypoglycemia, galactorrhea, hypocalcemia, and hypoglycemia. The nurse must monitor for side effects of plasmapheresis, which include hypotension from fluid volume changes, then hypocalcemia from the citrate used during plasmapheresis. Also, there can be chances of fluid overload also and infection. After the nurse provides patient education to Ms. Jordan, the patient states that by taking her medication as instructed and planning frequent rest periods in her day, she should expect which outcome? She will succumb to her disease within 5 years, her symptoms will be controlled and she can consider the disease cured, she will be able to manage her disease and have quality of life, she will not develop any respiratory complications. So the patient is taking the medications for myasthenia gravis. Nurse must educate the patient regarding their disease management to minimize the fatigue and optimize living with myasthenia gravis. So she will be able to manage her disease and have a quality of life. Thank you so much. Hope you understood this video.